foot and monitor that inversion and eversion. I care most about their rear foot, to be honest. And not, as I alluded to, there's a multitude of things that you can look at the hip, knee, as well as the ankle. In this case, we're going to cherry pick just the hind foot, rear foot, inversion and eversion. So I'm going to prop you on your stomach and prone. The other thing that I'm going to do is I'm going to ask you to bend this knee up and just kind of flop it over. Why do I do that? So you can see her pelvis rotates, but so does the axis of the foot. And so now it's the sagittal plane, that oblique axis of the foot and the ankle is now better aligned with the true vector of gravity, and it just allows it to be a little bit more easily measured on my behalf. So there are some individuals who can't get into the position. Certainly they can find alternative positions or just standard prone. It just helps to ensure that I'm not being fooled by the obliqueness of the axis of the foot and the ankle. So we have a flexible goni. This is going to be at the axis of the hind foot. So essentially right at the talus is what I'm going to try and line it up with. I'm going to usually in clinic, I'm actually putting a dot there and then making sure that the dot stays within the fulcrum. Here, I'm gonna forego that. And then I'm gonna essentially move the heel as I move the ankle. Honestly, it's very difficult, or I find it difficult, to essentially get them both to move simultaneously. So oftentimes I will ask for a second pair of hands where I will manipulate the foot into inversion and then, so we won't be looking at eversion on this foot, but if I could move it into eversion, then we would do the same, where my handhold is like this, and then I'm cupping the heel and then tilting it into inversion and eversion by moving and wiggling my bum and moving my body rather than trying to manipulate it with my hands. So I do find that this assessment in particular goes best and is most accurate with a second pair of assists. Okay, so that is the inversion and eversion. How much are we looking for